Welcome to Houston Newsmakers. Actually, we've been talking with Congressman Babin about getting back to work, and he's talked about the fact that he's in favor of what the president's doing, getting us back to work in phases, as you will. Congressman Babin, let's talk about the need for testing. A lot of the medical experts say testing is really going to be one of the components that will help determine our health and how soon we're able to get back to work. How are you focused on trying to help get more tests for any constituents you might see the need for?
I am spending an enormous amount of my time trying to find test kits, trying to find cartridges for the new Abbott and Cepheid testing machines. Just trying to, because I think that testing, whether it be a serological test, test whether an individual has had it before and now has the antibodies and he's recovered, or whether he's got an active case going. This is the key. This is the key to going back to work, to determining who has had it, who has it. When you have a test that takes days to come back, that really throws a lot of convolutions instead of a simplified, well, you've got it, so you stay home. You have to be waiting on a test for hours or days at a time. And we just can't have this. And so we absolutely have to know who's got this, so that when people go back to work, they will know. If you've got antibodies, you may have an immunity to it if you've already had it. These are the folks that can go back to work. So testing is the key to defeating COVID. So naturally, I'm not going to leave out having a vaccine. We got to have therapeutics and vaccine for it, too.
Absolutely, down the road. The latest plan from the White House was about getting back to work. Talked about phases. It wasn't very specific on testing, on providing testing, the kind of money that might be necessary. That seemed to be an ambiguous area. Are you working with either local, state, government? Who's in charge of trying to make sure that we can staff up and have the number of tests that everyone seems to agree we're going to need to have in order to make this thing work?
Well, I have been on many conference calls with the vice president's team, with Dr. Fauci, Dr. Birx, the admirals that they have in charge of procuring a lot of the PPE and the testing equipment. I was on with Health and Human Services yesterday. A young lady is trying to help us get some testing equipment and the kits. So that is one of the biggest things that we've been actively doing is trying to get these types of supplies and materials so we can test. No question. Any
optimism about making that happen? As you talked about, that's one of the keys to getting it done. So it seems to me that should be a high priority.
Oh, it's a huge priority. As I said a second ago, I mean, testing is the key to defeating COVID-19. There's no getting around that. We've got to know who has it, who can go back to work, who is, if you have underlying health issues. These are all, even in every phase of President Trump's reopening, the elderly, the people with underlying health problems, these are all vulnerable populations that are going to have to continue to have social distancing and to be very, very cautious so they don't get this. Let me just say this. The president has done a tremendous job with this. He's taken a lot of criticism, of course, from the opposition, but I thought it was very, very, I think as soon as we knew what was going on with Wuhan, the Wuhan virus, I think that he made the right call by suspending air travel to and from China, and then subsequent to that to other areas and hotspots around the world. Sadly, the Chinese government under the Communist Party continued to allow international flights out of Wuhan into Europe, into the United States and other countries, when at the same time, it's my understanding they were not allowing flights out of Wuhan to other parts of China, which doesn't speak well for that communist regime. And I think this is why they need to, there needs to be an investigation to find out exactly what in the world they knew, when they knew it. It doesn't look good, Cambrell, not at all.
The president says the World Health Organization bears some responsibility in all of this. He wants to pull money out, and you've agreed with him. Let me ask you, why not take a step up and lead as a nation as opposed to taking money out and weakening that body? Don't we need that World Health Organization to be healthy going forward?
Well, the World Health Organization is only as good as their leadership. under their general secretary Tedros from Ethiopia. I have not seen that type of leadership. In fact, what we were seeing out of him was he was covering for the People's Republic of China, the regime there. It was incredible. While we couldn't get information out of them, and while they were turning down help from us and Europe and other countries that wanted to come in and help China, the Secretary General of the WHO, was covering for the Chinese regime, and they were arresting their own doctors who were warning of it. Even today, I mean, just in the last 24 to 36 hours, we have gotten a 50% increase in supposed casualties and fatalities of COVID-19 in China. And what we've said all along, that we just were not getting the right information. And the World Health Organization was certainly right there with the Chinese instead of helping the rest of us. And there's been Cambrell, there's been surveys, and there's been people that have looked into this, and they think that this pandemic could have been avoided had China done the right thing and had Secretary General of WHO done the right thing as well. So this is why I think somebody needs to be held to account. This is costing the American people and the people around this world trillions and trillions of dollars and hundreds of thousands of lives, and people who have had their health status impacted, even if they've recovered. Some of them don't come back all the way. And so I think there needs to be an accounting here. There absolutely does.
Congressman, thank you for your time today. It's always great to have this conversation. I'd love to have you in studio, obviously, where we can.
I know it.
But hopefully we'll get back to normal sometime real soon. And with your help and your constituents and dealing with your communities, you and the other Southeast Texas congressional delegation, making this community get back to normal as quickly as we possibly can. Thank you so much, sir. We appreciate your time.
Thank you, Cambrell. God bless you, and God bless America.
Thank you. Stay safe, sir.